Good morning, ladies and gentlemen. That's for you if you're here in Lagos, Nigeria, or you're watching from any part of Nigeria. But if you're not in Nigeria, well, maybe good afternoon to you, most likely, or maybe good evening, as the case may be. You are very, very welcome to the symposium organized by the Ladies in Sport International. And it's a pleasure to actually have you here join us for a topic that has me signed, especially whenever I remember the stories of those that have been through this. Well, I am actually excited to be talking about it because we will be shining the light on fibroids. And just in case you're wondering why fibroids, well, I can tell you confidently that you'll be getting the answers to those questions in the course of this 2 hour symposium. We have our guest and our interviewers, our panel already joining us. So you can be very sure it's going to be a very rich session today. The Ladies in Sport International is a non-profit organization that was founded in 2016 by Tega Onojaife, and they are the forefront of leveling the field when it comes to gender inequality issues in sports generally. Now, this program is sponsored proudly by the pioneer of digital banking in Nigeria, and I am talking about Wema Bank, and of course, Smooth 98.1 FM, the smoothest dial on Lagos Radio. My name is Oluwaseun Olusegun. Now, in the course of this, if you have any questions while we bring on our guest, any questions at all, if you're seeking clarification or there is something you're not very clear about, if you're joining us via Facebook, you can always drop your questions or your comments in the chat box. And then if you're joining us via Zoom, you can also do that. Just go to the chat box option, drop your comments, whatever it is, and we will attend to you. I do have a rich lineup, like I said. So later on, we will be having, or rather shortly, we'll be having the Chief Executive Officer of Nordic Fertility Center. That is Dr. Abayomi, and he will be giving us a very, very packed one on fibroids. Later on, I'll be having an interview session with Dr. Oluwojebutu. That's Benjamin Oluwojebutu. He's the founder of Benjamin Oluwojebutu Foundation. We also will be talking about fibroids. That is why we're here in the first place. And later on, we'll be having the gender banking officer of a bank that is at the forefront of gender equality issues in Nigeria. That is Amarachi Ikwomadu. So she also will be talking about this. So please relax and enjoy everything that we have to offer you. Now, don't be stingy. Please share this link with your friends and anybody you feel should be part of this conversation. In the meantime, you can follow LIS International across all social media platforms. Start with Facebook at LIS International. Then move over to Instagram at LIS International and Twitter. Yes, I said Twitter. Go to Twitter too and follow us so that you are abreast of everything this wonderful organization is doing. Do not be left out. So we take a break now, and when we come back, we'll be going right into the agenda of today. Please stay tuned.
Ever wondered how easy it would be if your bank was part of your life? Sort of like an assistant, a buddy, and a plug.
Alert, you there?
Always alert, sir.
I see what you did there. Am I up to date? What was that?
Your repayment has just been done. By the way, I found a cheaper ticket for your flight.
Awesome. Schedule my run for 7:19 a.m. tomorrow. I missed it this morning.
Already done.
What else?
Grocery shopping. The list has been sent to your phone.
Perfect. Anything else?
All done. Just get ready for your date.
All right, cool.
Welcome to the future of banking. Alert. Simple, reliable, and convenient. A smarter way to bank.
Thank you so much for staying tuned to us. In case you're joining us for the first time or you're wondering where you are, maybe because somebody shared the link. Well, this is the Ladies in Sport Health Symposium, and it is tagged Fibroids, What You Need to Know. I did say that we are going right into the agenda of today, so I will be bringing up Dr. Abayomi Ajayi, and he is the Chief Executive Officer of Nordic Fertility Center. They do have quite a number of offices in Abuja, in Asaba, and here in Lagos, of course. Now, Nordico Fertility Center is dedicated, they are specialized in a lot of things when it concerns the women's health, fertility. And he's a specialist. It is a specialist clinic that is dedicated to non-invasive and minimally invasive treatment of benign gynecologic conditions such as uterine fibroids and adenomyosis. Actually, they just launched a new non-invasive treatment, which Dr. Abayomi will be talking to us about, and we very much look forward to that. Also, Dr. Abayomi Ajayi, he's very passionate when it concerns helping people achieve their dreams, and as a result of that, he has inculcated it into his career as a fertility expert. If you follow this fertility center, you know that he's very passionate about giving bundles of joy to people when it comes to children, and that's one thing that makes me smile every time I see the stories. Dr. Abayomi Ajayi also is the country's representative of the OBGYN.net, and that is a network of obstetrician and gynecologists all over the world. It has membership of many international professional associations, including the Global Health Council. He is the founder of the Physicians Roundtable, the Endometriosis Support Group, and he's the co-founder of the African Endometriosis Awareness and Support Foundation. Dr. Abayomi Ajayi is also the convener of the Dr. Abayomi Ajayi Physicians Mentoring Program. That's a platform that is aimed at providing mentorship and guidance for young medical professionals. I did tell you he's very passionate about the profession. He is a member of the Association of Fertility for Reproductive and, for Fertility and Reproductive Health, that is AFRH. Also, the Society of the Obstetrics and Gynecology. Also, American Society for Reproductive Medicine, American Association for Gynecological Laparoscopy, International Society for Gynecological Endoscopy, American Society of Liposuction Surgery, and American Academy of Cosmetic Surgery. Quite a number of accolades. Well, that is not all. Dr. Abayomi Ajayi is also an alumnus of the Stanford University Seed Institute for Innovation in Developing Economics and Economists, and a board member in the International Society for in vitro fertilization, otherwise known as IVF. So ladies and gentlemen, boys and girls, men and women, wherever you may be joining us from, please give your round of applause as I bring up Dr. Abayomi Ajayi.
A group that I admire so much because I was never good at doing at sport. As much as I tried, I couldn't do it even to save my life. So I consider it a great pleasure to have that platform today, to talk to people generally, but especially ladies who are involved with sports. Thank you so very much. So thank you for giving us this platform. It's the one-day health symposium on fibroids. And it's titled What You Need to Know. I'll try as much as possible. I might not be able to try to fill in as much space as I can. By one thing before I go on is that Nordica also has opened what we call a fibroid care center, which is entirely different from the fertility hub. This deals with fibroids, and we do all kinds of treatment for fibroids, including what we're going to be discussing about today, the non-invasive form of fibroid treatment. So let's start by defining what fibroids are. Fibroids are benign lumps that grow in and on the uterus. That is, they are not cancerous. So they just lumps, they are bumps on this uterus. They grow either in or on the uterus. And they are probably the most prevalent tumor in the pelvis of the female. About 70 to 80% of women below, by the time they are 50 years, will have fibroids. And this range in size from seedlings, which sometimes might be undetectable by the human eye, to very bulky masses. And they can enlarge and distort the uterus or the womb. They might be single or multiple. If you see I try to put these different sizes. They can be from the very, like a peanut up to the watermelon. So they can be as large as that. So it's not unusual to see them expanding the uterus as much as the rib cage. So some people are mistaken to be pregnant when they have fibroids, and some people can actually have gain weight as a result of what they're carrying. And like we said, fibroids are commoner in the childbearing age, but they can show up at any age. They tend to be commoner in blacks more than whites. We still don't know why this is so. We believe it's genetic, but there is a lot of things that say, a lot of studies still being carried out in this direction, but we're yet to find the real reason why this is so. What causes fibroids? That's like the $1 million question that we get asked all the time. Well, nobody's sure, nobody's certain for sure, but we know that it's related to hormones, and like I said earlier on, genetics may play a large part in this. But what are the risk factors for uterine fibroids? Age, it's number one. The older a woman gets, the higher the chance that she will have fibroids, especially if she's not had a child. The black race also is a risk factor for fibroids. When women who get their periods very early on in life also are more predisposed to fibroids. So if you see your menses before 12, you are more predisposed to fibroids. People who use birth control pills are more predisposed to fibroids. And then being overweight or obese is also a predisposition to uterine fibroids. Well, I probably think this is where probably women in sports might be a little bit luckier than the general population until they retire, of course, when they sometimes also put on weight. Eating too much red meats and not enough green vegetables, fruits or dairy might also be a predisposition. Alcohol consumption might be a predisposition, but the most important probably is the family history. Women who have a first relative, that's either your mom or your sister, has fibroids, you are more likely to have fibroids than the general population. Well, what are the symptoms? How do I know if I have fibroids? Well, the first thing that many people have fibroids that they don't have any symptoms at all. And it's not unusual to be discovered incidentally, either during a pelvic examination, maybe if you are one of those who do the annual medical, which I encourage people to do, or when people get pregnant and they do ultrasound just to see the baby, and then suddenly the doctor informs them that they have fibroids. But in many other cases, there are symptoms, and this might just include heavy menstrual bleeding, okay, sometimes the passage of clots, prolonged menstrual bleeding. Some people bleed for about 7 days. The usual is 3 to 5. Some people bleed for 7 days. Some people bleed longer than that. So anything longer than a week is really something that should make you to find out why this is so. And there's also some people bleed in between periods, okay? And this is also can be a sign or a symptom of fibroids. And for some people, they just feel there's pressure or pain in their pelvis, okay? They might just feel that there's a mass, there's a bulkiness in the abdomen. And for some, you could have also because of the pressure that is there, if it's impacting on the bladder, because the uterus is surrounded by some neighbors, the bladder and in front and the intestine behind. So you could have frequent urination, you could have difficulty emptying the bladder, you could have constipation, you could have back ache or even leg pains from fibroids. Now, there are 3 types of fibroids. Okay, well, I'm going to show the picture later on, but just if you follow me, there are 3 main types of fibroids. What we call the intramural fibroids, that is the fibroids which is within the muscle of the uterus. This is probably the most common form of fibroids, and then the subserous fibroids, the one that grow outside of the uterus, and this, as they grow bigger, they probably cause pain due to their size or pressure, like I said, on nearby organs. And then there's the submucous fibroids, which grow where the baby should be, which is inside the uterus itself. They usually grow underneath the lining of the uterus, and they can crowd the uterine cavity and lead to very heavy bleeding and some other more serious complications. I'll just show you what I mean by this. So the diagram here is illustrating the different kinds of fibroids. You can see one is actually inside the muzzle of the uterus. The one on top, the topmost one, is in the muzzle of the uterus. And then you can see the one to the left is in the where the baby should be, which is that's the submucous. The first one is the intramural. And then the one on the right, the rightmost one, it's going outside the uterus, and that we call it a subserous fibroid. Now, how do we make a diagnosis of fibroids? And really and truly, this is one of the most important things. Like we said earlier on, for some people, it's just an incidental finding during a pelvic examination. The doctor is examining you. Either you want to do a pap smear or whatever, and then he sees that you have fibroids. And then for some, like we said also, maybe you have done a scan and then you find that you have fibroids. But these are usually the two most important ways that people see that they have fibroids. But there is a third way which actually is getting more common now, which we call MRI or magnetic resonance imaging. Now, this for a very long time, we have thought that every swelling of the uterus is fibroid. But what we are seeing now is that a lot of them might be what we call adenomyosis and not fibroids. And this might also be one of the things that is responsible why people have a lot of recurrent fibroids in our environment, because the diagnosis has never been made. It's an adenomyosis, why you think you have fibroids. And even the surgery for fibroids will not cure adenomyosis. So, and that's why MRI, if you see this picture that I'm showing here, this is a MRI images. And the one on the topmost one, you can see has like a definite capsule. That's a fibroid, okay? But the one below, the white line is actually what we call the endometrium. And you can see the one below that the endometrium is displaced, because what we have there is adenomyosis and it's not fibroids. I don't intend to turn you to doctors in this 10 minutes or 15 minutes, but I'm just trying to let you see that sometimes what we think are fibroids are really not fibroids. And there was a study that was done in the University of Jos, which showed that about 39% of the cases that they never discovered that they were adenomyosis. They were treated as fibroids, and they removed the uterus for thinking that they had removed uterus for fibroids. But when they took them to the laboratory to examine, they saw about 39% of them had adenomyosis. Now, the next question is, what is adenomyosis? Adenomyosis is a form of endometriosis. Sorry, I'm going to be using some of this technical, but I try to, if you don't close your mind, I'll try to break it down to what we can understand. Unfortunately, there's some words that we cannot, we just have to call them their names and then we explain what they are. When we talk about adenomyosis, it's a form of endometriosis. And if endometriosis is the occurrence of the lining of the uterus where it should not be. So it's like you have where you are bleeding from. You know, a woman sheds the endometrium every month in what we call the menstrual period. Now, when you have this lining that is shed in other places, apart from where normally you shed it from, we call it endometriosis. Now, when it is inside the muzzle of the uterus, we call that adenomyosis. So this is one thing that I want us to understand, that is dealing so much with us. Just like we started talking about endometriosis about 15 years ago, and now we know that endometriosis is a lot with us. This is also one of the things we need to start putting into our consciousness, that adenomyosis, which is a form of endometriosis, is as common as endometriosis in this environment as well. So other ways that we can do investigations is what we call hysterosonography, which is just, forget about the big name, it's just, we call it saline test. So we can just forget about that. And then we have hysteroscopy, which is a form of we have like a telescope that we can put into the vagina to see inside of the uterus. And that also does not only make a diagnosis, but can also treat fibroids, especially when they are where the baby should be. What are the complications for fibroids? If I have fibroids, what can happen? All right? Because you might be bleeding excessively, it's not uncommon sometimes to be short of blood, what we call anemia. When the fibroids become so big, and we're seeing quite a number of people with very huge fibroids, like it's like they have 9 months pregnancy. Sometimes there can be back pressure. The tube that carries the urine now starts having a back pressure because of the size of the fibroids. And sometimes actually it can lead to renal damage. So when you have huge fibroids, it's not something that you just say, okay, I'm going to live with it. You need to look at what is happening. Is it affecting your kidneys? Is it so? We don't have a late stage diagnosis of renal affectation. Then it can lead to infertility. Also, for people who are doing IVF, of course, it will lead to reduced success rate in IVF when you have fibroids, especially when you have the one that's staying where the baby should stay. And then also, of course, it will also lead to things like when you are pregnant and you have fibroids, it could lead to what we call red degeneration, which is just that the blood supply to the fibroids gets insufficient and you have a lot of pain. So it's not unusual for some people when you can get pregnant with fibroids. Let's get that right. But you could also have some problems which we call red degeneration when you're pregnant, which can cause a lot of pain in pregnancy. And sometimes patients get admitted because of that. Fibroids can also lead to miscarriages. So it's not unusual for some people to miscarry when they have fibroids. And then for some people, they can carry the pregnancy to term, and then the baby is presenting with the foot or some other parts and not the head because the fibroid is occupying where the head should be. And then, of course, sometimes some people will deliver and they have a lot of bleeding after delivery, which we call postpartum hemorrhage, and which can lead to some other things, either blood transfusion, sometimes even unscheduled surgeries. But how do we treat fibroids? If we have fibroids, how do we treat? Let me tell you first and foremost that it's not every fibroid that needs to be treated. So the first thing, these are the things we consider before we start thinking of whether to treat and how to treat. Do you have symptoms? Okay. Do you want to get pregnant? Or you have finished your family? This will help the doctor. How old are you? What is the location of the fibroid? These are the things that the doctors juggle in their minds when they're trying to give you the solution to the fibroids. So let's look at the options. So the first thing, like I said, is not every fibroid that needs to be operated on. So sometimes we do what we call watchful waiting or wait and see approach. Because fibroids are not cancerous, like we said, they are benign, and they usually grow slowly, and they may even shrink after menopause. So it depends on when we catch it, what are the symptoms? Is this something that we can just monitor and wait? For example, if you are near menopause, we might just want to wait and your symptoms are not really very bad. We can just want to wait and see whether it will shrink after you hit menopause, because we know that they are hormone-dependent growth. So and we know that at menopause, the secretion of estrogen reduces. So it's like you are starving the fibroid of food, so it might not really grow so much, and the symptoms might even get better after menopause. So it's not every fibroid that, and then if the size is not even big enough, we do not want to operate on them. And if you do not have symptoms, like I said, we might just watch and wait. There's some drugs that can be used also when you have fibroids. Well, I'm not going to mention so much about the drugs because I'm not going to encourage self-prescription. There's some drugs that can be used, but the problem most of the time is that people who want to get pregnant might not be encourage to use these drugs because majority of them will not allow you to get pregnant. So if you have infertility and you have fibroids, drugs are not your best friends. Now, most of the time, when you have fibroids, people think about surgery. Well, maybe because it's the oldest form of treatment for fibroids. And maybe also, it's probably the most definitive treatment for fibroid. But hear me out. There are different kinds of surgeries that we do for fibroids, okay? One is called myomectomy. That is removing the fibroid but leaving the uterus behind. Okay, this has been done since 1840, and the surgical procedure has not really improved so much since it was discovered in 1840. So this can be done abdominally through the abdomen, which will leave a scar, but this can also be done vaginally. It depends on, that's why we said the location of the fibroid is one of the things that the doctor will consider when he's trying to profile a solution to fibroids. And recently also we started doing what we call minimally invasive surgery or endoscopy. All this, what I'm talking about, are readily available in Nigeria. So I'm not talking about something that happens somewhere very distant. So we have something we call hysteroscopy, which is like I said the other time, is like a telescope which you can introduce through the vagina into the uterus. And so if you have fibroids that in where the baby should stay, in the inside of the uterus, then this is the best way to remove them because the scar formation is very minimal from this. It's different from when you are trying to use myomectomy through the abdomen for this kind of fibroids, which are where the baby should be. You can imagine the kind of scar that you're going to leave behind. The other form of endoscopy is what we call the laparoscope, which is you have a small nick under your navel, and we have this kind of telescope that we can put there, and we can remove fibroids also through that. We can even remove the uterus through that avenue. Depends on who is doing what. Then also there is a method that is not particularly very common in Nigeria, which we call the endometrial ablation. This is for people who have finished having their family and they have fibroids. You just, because we know that the bleeding is from the endometrium. So just burn off the endometrium, we call it endometrial ablation. And then the woman starts bleeding. If all the problem is with bleeding, then you can still preserve the uterus, which cannot be used for pregnancy anymore because you destroyed where the baby should stay. And then, but the bleeding just stops. And of course, you can remove the uterus, which, like I said, is probably the only cure for fibroids. Every other method, you have a chance of recurrence, but the chance of recurrence differ from one method to the other. So when we talk about removing the uterus, we can remove it through the abdomen, which will leave a scar. You can remove it through the vagina, and then you can remove it through the laparoscope, just like I said earlier on. What are the complications that can happen from surgery? This probably is the most dreaded: blood loss. This is one big problem from fibroid surgery. And so you can have blood loss, and then you can have problems from blood transfusion. Even when you're trying to arrest this blood loss by giving blood transfusion, you can have problems from it. And then because anesthesia is involved, you can have problems from anesthesia. And then, of course, sometimes you have to remove the uterus, despite the fact that your plan was to do myomectomy, that is, remove the fibroid and leave the uterus behind. But when there's terrible blood loss, you might have to remove the uterus. But that happens not very often. But there are other complications that you can have from surgery. One of which is you can, because you have cut the uterus, you can have scarring in the inside the uterus. So what we call adhesions or scars in the inside of the uterus. So we call it intrauterine adhesion. So there are scars in the uterus. And we looked at over about 990 something patients that we saw for infertility over a period of time. And we saw that about 30% of them had intrauterine adhesions, mainly from fibroid removal. So that is also one thing that can, so you can remove your fibroid because you want to get pregnant. And then because we now have adhesions, you don't get pregnant anymore. Sometimes this is beyond what the doctor can help, because anytime you cut something and then you sew back, there is this risk that you have scars. It's just like when you have injuries on your body, sometimes you end up with scars. And we blacks are even known to have a predisposition to forming scars. So scars are something that and that's why we're talking about either you're doing hysteroscopy, if the fibroid is where the baby should be, we, as much as possible, want people to, we know also that this endoscopic surgery is not available in every hospital in Nigeria, but we're trying to see how it gets better over time. And then, of course, there is a chance of recurrence. I think that's, if there are going to be any questions, I'm sure I'm going to get a lot of questions about recurrence, but there is a chance about recurrence if you have not taken out the uterus. Because of these complications, now people are talking more about minimally invasive and the non-invasive methods. When we talk about minimally invasive methods for treatment of fibroids, we've spoken about endoscopy. And then there is another one called uterine artery embolization, whereby you don't cut open the abdomen, you inject there's some specially made things that you inject into the uterine artery to sort of starve the uterus, the fibroids of food, and then they wither over time. And there's also the non-invasive, where you don't even touch the patient at all, as it were. She just lies down on the table for about 2 hours. After that, she gets up and everything is done. And like many people will say, it's like magic. And this is the machine for doing that, what we call HIFU, high intensity focused ultrasound, which I'm going to talk about a little bit today. And that's where the Fibroid Care Center really comes in, because this is the only machine, the only HIFU machine in the whole of West Africa. Is the third one in the whole of Africa. And we've started doing quite a number of things with this. Now, what are the benefits of HIFU? It's like it attends to all the problems that surgery can create. No blood loss, no anesthesia, you have faster recovery, and you're back to work within a week. Then you have reduced risk of uterine rupture when you get pregnant, and the reduced risk of having adhesions or scars in your uterus, which surgery can lead to. But is it everybody who can have HIFU? The answer is no. It's not every fibroid. We cannot treat every fibroid. Now, I'm going to make your life a little bit more complicated if you can see the diagram that, doctors, we like making things a little bit complicated. I think, I don't know if you can see this diagram that I'm showing, because I said there are relative contraindications to HIFU. There is this type O fibroid, that is the fibroid that is inside the endometrium and it has like a stalk, it's pedunculated. Why? Because if you use HIFU for this kind of patient, it's likely that fibroid is going to drop into the cavity of the uterus and could, over time, want to get expelled. So it could lead to some problems for the patient. But if the patient understands this, or if we know that we can remove this over time, then that's why it's a relative contraindication. It's not an absolute contraindication. Patients that we also run away from are people who have done abdominal liposuction, because with them there's some distortion, there's carrying already from the liposuction, and then we might not be able to, because how HIFU works is that we're converting ultrasound into heat energy. So there must be a safe pathway for you to hit the fibroid, and therefore, if there is distortion in the abdomen, that might be complicated, especially when there are scars around the whole place. Then that might complicate how you get to the fibroid. So there are people that we try to avoid if we can, and then people who cannot communicate, because in HIFU we don't send you to sleep. We just sedate you. We want you to be able to talk to us as we're doing the procedure. You're just going to lie on the table, but you need to tell us whether you feel that your abdomen is getting too hot, whether you have pain in your legs, because that will help us to shift where the ultrasound is being focused at, so that we do not have complications from the procedure. So if you are not able to talk, then we are afraid to want to take you on. But the absolute contraindication to HIFU is that if somebody cannot lie with face down for at least 1 hour, such a patient cannot do HIFU because you need to lie on the bed. We don't touch you throughout the procedure because we're just going to be looking at the fibroid. We will have done some investigations. We know exactly where the fibroid is. So what we're actually doing is to set your fibroid on the machine, and we're hitting right on the machine. You will be feeling it, and then you are telling us if you're feeling uncomfortable. If you're not feeling uncomfortable, it just goes on like that, and then we can change from one fibroid to the other, and change from one fibroid until when the job is done. What are the possible complications that can arise from HIFU? Skin burns. And that's why we say it's important that you're able to communicate with us, because you're going to lie on the bed and water will be coming in contact with your skin from the bed. Now, we want to know if the water becomes too hot for you, if it's uncomfortable for you, we want to know so that we can reduce the temperature, and then so that we don't have skin burns. And then you're going to see, we've had some experience here. There's nobody who has had skin burns. And people who have done quite more than what we have done also have been able to avoid skin burns. The other thing is that you can have bowel injuries, but this is also two things can lead to this. Either you don't prepare your bowel well. So there is a bowel preparation where we give you drugs, and we tell you what to eat, what not to eat for about 3 days before the procedure. And then we ensure that your bowel is empty before the procedure. And once that is done, you are good. So, and we also do sometimes for people who have had previous surgery, we want to see that there is a safe pathway to channel the ultrasound in such a way that your bowel will not be affected. So we do that, and then once we have done that, the chances of bowel injury is almost zero. And then the other last one is that you could have nerve injuries, but this is also preventable, completely preventable, when you can talk to us, because this happens because there is vast scatter of ultrasound to the nerves, especially for people who have fibroids that are very near the bone where the nerves pass through. So when you're having this procedure and you have pain in your legs, we want you to tell us, because that usually will tell us that, okay, we need to change the direction where we are hitting the fibroids from. And once we do that, everything is okay. So really and truly, this procedure can be completely complication-free, especially when we have the cooperation of the patient and everything is done according to the letter. Now, in Nigeria, we introduced the first patient we did on the 25th of June. And so far, we've done 31 patients. I think 2 will be done to be making 33. So out of these 31 patients, 24 of them have uterine fibroids. 3 of them came with diagnosis of adenomyosis, ab initio. But we found that 4 out of the 24 had a combination of adenomyosis and fibroids. Now, what are these complaints that we heard from these 31 patients? 5 of them complained of low abdominal cramp immediately after the procedure, which was amenable to analgesics. 2 of them complained of transient leg pain, which after the procedure, when it was completed, they were completely fine. 3 of them complained of lower back pain after the procedure. Of course, analgesic also was applied, and they were good. Now, we've had some delayed complaints from some patients. 2 complained of heavy menstrual bleeding even after the procedure. But these were people who had adenomyosis. And what we do with people who have adenomyosis is that we prescribe some injections for them to continue to shrink because don't forget that adenomyosis is bleeding inside the uterus, into the muscle of the uterus. So we might not be able to burn everything away at the same time. So what we do is that we burn as much as we can burn, because don't forget, when I use the word burn, I mean ultrasound is converted to heat energy to burn the fibroids or the adenomyosis. So we might not be able to burn everything away at the same time. So we give you some injections that will help to kill whatever is left behind. So you take that for the next 3 months. So it's not unusual for people with adenomyosis to still have some menstrual bleeding, heavy menstrual bleeding, which will get better over time. And then after a woman complained of pelvic pain again, and 3 complained of watery vaginal discharge. This vaginal discharge was because of the location of the fibroid, which was dying off, because they had submucous fibroids. The fibroids were where the baby should be, and so they were shed off after some time. But everybody, the 31 patients, they are good and they are okay. So I like to conclude by saying that uterine fibroids is common among women of reproductive age group, especially those of us who are Black, and it commonly presents with heavy menstrual bleeding, abnormal swelling, and pressure symptoms, which negatively affect the quality of life of women. Definitive treatment is hysterectomy. However, for women that still require or desire to retain their uterus, non-invasive treatment such as IFU is effective and safe. So once again, I thank the organizers, ladies in sport, for giving me this opportunity. And of course, I will be willing to take questions if they come. Thank you so much for listening.
Has no idea whatsoever of what fibroids is. Well, now they have an idea. And no, you didn't so much complicate things for us. You actually helped us to lay it all on the table, especially with all the data. That is very important, because one of the challenges we have with a number of conditions here in Nigeria, whenever we're trying to check the prevalence, is that there is no much, we do not have much data. So thank you so much for giving us all that data. Now, we do have questions, but in the meantime, if you're joining us for the first time, this is the Ladies in Sport Health Symposium that is tagged Fibroids, What You Need to Know. And we have our beautiful, our wonderful and lovely sponsors. That is Wema Bank PLC. They are the pioneers of Africa's first fully digital platform, and that is very impressive. And of course, another sponsor is Smooth 98.1 FM. Love music, love life. So if you do have any question, if you're joining us on Facebook, you can drop it in the chat box like the ones we already have there. And then if you're joining us on Zoom, you can do the same by just dropping it in the chat box. So I will start with the first one we have from Esther Kanan. She says, I have submucosal fibroids of 4/3 centimeter. I am yet to deliver and ready to, but I am afraid of surgery. Is uterus fibroid embolization a good option for me? And then she adds that she's 33 years old. Dr. Abayemi.
Yes, no, there's still some things about embolization, and people want to have children. And this we need to be careful about. The thing is that there is, like you said, data is sparse in this area. I think what this person should do first and foremost is to have a good assessment of the fibroid. Where is it located? One of the things I said is the location of the fibroid determines where you're going to, what you're going to do. So where is this fibroid located? What's the size? And then we can then make a recommendation. But just shooting from my hips, it's a little, because this is a 33-year-old woman, and she wants to, that is a reproductive age, and we need to be careful. So I'm not going to make any recommendation on the screen. I prefer that she will have the proper assessment, and then she can be advised on what to do.
Thank you very much. And one thing that I was able to get from your presentation earlier is that not all fibroids actually need to be treated. However, you wouldn't know that if you do not consult your specialist. So yes, medical treatment generally are very individualized. So I think that's one answer you need to have, Esther. You need to see a specialist. Now let's go to the second question. This one's coming from Judith from Lagos. She says, Doctor, what causes a thick endometrium?
Well, a thick endometrium is not fibroids per se. It's that it could come from that you're not ovulating regularly. It could come from usually it's hormonal in nature. So either you're producing too much estrogen or you're not ovulating regularly. So, but that I will not count as a disorder because it depends on how was it even diagnosed. Was it through scan? What was the measurement? Who is telling you about it? Thick endometrium. So these are things that you need to be more specific. If, for example, you give me what the measurement of the endometrial stripe is, then I might be able to give you a more specific answer. So please, if the person can either send an email and give me specifically what you mean, and then I might be able to help. Because I'm careful about the answers I give on air so that I don't mislead you in any way. And please, if you're going to also get, we say that if you're going to get the whole answer, you must give the whole story. So please, also give me as much information to help me to be able to help.
All right, then I do hope that she's able to hear that and maybe follow up with the questions. For now, we do not have that. But in the meantime, if you actually want to seek out more information from Dr. Abayomi, he is very active on social media. And I mean from Facebook, Instagram, Twitter, LinkedIn. So that is Dr. Abayomi Ajayi across all social media platforms. So if you need him, if you need clarifications, or you even want to go a step further and ask more about the high intensity focused ultrasound, that's HIFU, which actually is a delight to a lot of people who are scared of surgery, you can definitely seek him out across all social media platforms. So thank you so much, Dr. Abayomi, for this really rich information. And I know somebody already has more information about fibroids, and that it is not all gloom and doom. Thank you, and thank you again. We look forward to more time with you and more sessions of you spreading the knowledge about fibroids and fertility. Thank you, sir. Now we move over. Let's take a quick break from our sponsors. And when we come back, we'll still be talking more about fibroids, what you need to know, the emotional aspect, the financial aspect, and every other thing, especially the toll it takes on you as a patient and maybe your relatives. This is the Ladies in Sport Health Symposium tagged Fibroids, what you need to know. Please stay with us.
Ever wondered how easy it would be if your bank was part of your life? Sort of like an assistant, a buddy, and a plug.
Alert, you there?
Always alert, sir.
I see what you did there. Am I up to date? What was that?
Your repayment has just been done. By the way, I found a cheaper ticket for your flight.
Awesome. Schedule my run for 7:19 a.m. tomorrow. I missed it this morning.
Already done.
What else?
Grocery shopping. The list has been sent to your phone.
Perfect. Anything else?
All done. Just get ready for your date.
All right, cool.
Welcome to the future of banking. Alert. Simple, reliable, and convenient. A smarter way to bank.
Welcome back. If you're joining us for the first time, you're very, very welcome. This is the Ladies in Sport Health Symposium tagged Fibroids, what you need to know. And we are sponsored fully and proudly by Wema Bank, that is Africa's first fully digital bank. And of course, Smooth 98.1 FM, love music, love life. Now, if you have questions in any course of the conversation, please do not forget to drop it in the chat box if you're joining us on Facebook or on Zoom. And next up, I will be bringing up my guest. But do not forget that this is organized by the Ladies in Sport. And the Ladies in Sport is actually a non-governmental organization that was founded in 2016 to promote women in sport and also improve the standard of living for women in sport in Nigeria and generally. And since then, they've actually been addressing issues affecting women in sports industry and generally. And of course, that's why we're talking about fibroids, because it is something that affects women. I did say I'm bringing up my guest, and yes, that is Dr. Benjamin Oluwatosin Oluwojebutu. He's the founder of the Benjamin Oluwojebutu Foundation. A little bit of information about Dr. Benjamin. He is a brilliant, resourceful, self-motivated, and passionate graduate of the prestigious College of Medicine, University of Lagos. You can call him a phenomenal acolyte. He is a detailed physician with postgraduate training in family medicine from the National Postgraduate Medical College of Nigeria, with special interest in maternal and child health. He's a skilled surgeon with over 12 years experience who has worked successfully in several communities in West Africa. Now, under his foundation, which is the Benjamin Oluwojebutu Foundation, BOF, over 5,000 free surgeries have been performed in 12 states of Nigeria for folks that are suffering from fibroids, from hernias, lipomas, and breast lumps. He's also the executive director and lead surgeon of the BOF Love Team. Dr. Benjamin has very great communication skills. He's passionate about improving access to quality health in Africa. And this I can tell you for a fact. Love and compassion is the core of his life and practice. Dr. Benjamin is a licensed member of the Medical and Dental Council of Nigeria, that is MDCN, is also a member of Nigeria Medical Association, NMA, a member of Association of Rural Surgeons of Nigeria, ARSO, ASON, and associate member of Nigeria Institute of Management, NIM. He's married and blessed with kids. So ladies and gentlemen, wherever you may be joining us, please put your hands together, if you can, for Dr. Benjamin Oluwojebutu. Hello, good morning. Thank you so much for taking time out of your busy schedule to join us.
Good morning to you, Oluwaseun. How are you doing today?
Thank you so much. It's a pleasure to have you join us this wonderful day.
Thank you for having me today. And I'm happy to be here to be talking to ladies in sports. I think it's a phenomenal opportunity to talk to women, because women are the greatest assets that God gave us in the world. Every man came out from a woman. So especially I want to celebrate women today. And thank you for the opportunity for me to talk to them. And I want to thank our mentor, our leader, Dr. Abayomi Ajayi, for giving us that very profound lecture today on fibroids. So if your teacher has spoken a lot about fibroid, I would just add a little voice to it to elucidate a few things I have seen in my experience over the years. So good morning, Oluwaseun.
Thank you. Good morning, Dr. Benjamin. It's always a pleasure to have a chat with you. I remember the first time that I had this chat about fibroids. We went on and on for almost 1 hour. Again, it's a pleasure. Thank you.
Thank you very much.
Well, for a number of people who do not have information about what you do and why you're doing what you do, first, let's start from that question that I asked you. Why fibroids, actually? Why are you beaming the light on fibroids? You've done over 5,000 surgeries, free surgeries for people who have fibroids, lipomas, hernias. Why did you decide to go into this particular field?
So, I mentioned that one of the major issues we have in Africa is that there is fear and there is fun. I call it the double F. F is for fear, F is for fun. A lot of women have this problem. They cannot afford to do the surgery because it's quite expensive. And some people are also very, very afraid of the surgery. So what we've tried to do in our foundation is to bring hope and succor to take out the fear and give them faith and help them to do the surgery, because so that you take out their burden and their life can be meaningful again. You know, when you see a woman carrying fibroids and bleeding very heavily. A normal message was 3 to 4 days, but it's now 12 days, 15 days. She's wearing diapers. She doesn't even use pads anymore. Wearing diapers, wasting all her money on diapers, and she's anemic every day. Our own role, as an assignment for the world now is to bring succor to them and change the narrative using love as the baseline. So for us, it's about showing love and making people happy again. Imagine somebody living with fibroid for 20 years because they cannot afford to do the surgery because of the expenses. Somebody that earns just maybe 4,000 naira a month from selling kuli or selling granuts and beans or selling rice and potato on the roadside. And the surgery costs a lot of money for them. But you've been able to now take out that place of fun for them and introduce faith. That for me is very gratifying for us in our organization, and it's been very, very fulfilling going to villages that they have low access to healthcare. We've been to places as far as Bekwara, that is 1 hour from Cameroon. We've been to Boko in Makodi. We've been to a lot of places. We've been to Okpela in Edo State, Warri in Delta State. Been to Mboshinimi in River State. So those sorts of joy we give to these women are very, very gratifying because they get better and they, you see, calling you after 1 year, they have their children, now they can marry. When you carry that kind of mass in your tummy, is a lot of stigma. No boyfriend, nobody can talk to you because they think you're already married, you're carrying a baby. Some they call you Mama Ejima, they call you Mama Bon Boy, So you're not happy to interact with people because they're asking you questions that you don't have answers for. For us, it's about changing that narrative and bringing hope and joy to those families again. Thank you.
Thank you very much. Now, I'll read out something from a study that I found out online, and then I'll ask you a question stemming from that. So there was a particular study that was done by M.A. Adegbeson Omilabu and also K.S. Ukumade and A. Badegeshin. And it was all about the knowledge of, the perception of, and the attitude towards uterine fibroids among women in Lagos, Nigeria. That was a case study. Now, this was published in Scientifica in March 2014. According to the results from that, it was said that about 80% of those above 25 years of age are having fibroids. That is a high number. So my first question is, from your experience so far and your practice in this field, what is the prevalence of fibroids? Let's start with that.
No, so you're very correct. I think it's more now. I've seen a woman that is 21 having fibroid, very, very massive fibroids, I think from what Dr. Jai said in the morning, he talked about people using a lot of bed pills, and a lot of contraceptives. I think nowadays it's more common. Younger people are getting used to this contraceptive, which is improving, which is increasing their hormones in the body, especially hormone estrogen, and that is stimulating the fibroids to grow. So before, in the past, it used to be ages above 30, above 33, 35, but now people younger. So I would say it's more prevalent now. People 21, 22. I see them. I see those patients more and more now having fibroids now, and they're not just small masses, very, very big masses. So I think we need to keep talking to ourselves about use of birth controls as a form of predisposing factors for having fibroids. Then people can start taking care of not just using these birth controls just because you want to use them. You want to use them because it's just absolutely important. Not just use them regularly or use them because you're using them for using sake. So the prevalence is more. So you said 3 out of every 10 Nigerian women now have fibroids. It used to be 3 out of 10 in the last few years, but now it's about 4. So imagine 4 women out of 10 in Nigeria now, in Africa, have fibroids. Most don't even know they have the fibroids until the symptoms start showing. Some will tell you that they used to wear size 16 of skirt before, now they're wearing size 20. Some think it's just food. Some think it's about gari or fufu. Whereas no, it's about the fibroid growing in their tummy. I've seen women carrying fibroid, and they tell you that I didn't know I had fibroid. I just saw that my tummy was getting very, very hard, and I thought it was about namala eating in the night. So I started eating about namala at night, but it keeps growing big. So awareness, knowledge, and people and health seeking behavior is what we need to improve among women. So you don't think it's your father's father following you, or you don't think it's your mother's mother that is affecting you, or your village people. No. If you have those symptoms that Dr. Bayami has mentioned in the morning, heavy menstrual flow, increase in abdominal guts, your flow has increased from 3 days to 10 days, and it comes out with clots. You used to use 1 part per day, now you're using 7 parts per day. That is a sign that there's a fibroid growing in your womb. You need to see a specialist, see a doctor to get it checked on time. The earlier you get it checked, the earlier you get results sorted, then you can get better going forward. Don't always believe in those fallacies. There are so many fallacies in Nigeria, in Africa, because people have used people's fear and psyche to make a lot of money. I heard people saying that there are drugs, that there are some herbal medicines that shrink fibroids, and people are wasting all their money buying those kind of medicines, and it's worsening their lifestyle. They're having kidney issues, they're having liver problems. I've seen patients that have drank herbal medicine that is made from the cow dung. You can imagine somebody drinking a cow dung for 9 good years. Cow dung, and I tell them that cow dung is the answer to the fibroid. And I ask them a simple question: your alimentary canal, your GIT, is not close to your uterus. Somebody says that you drink a drug from your mouth, and you now go to the bathroom and you will pass out your uterus from your anus. It doesn't make any logical sense. But because women are afraid, and their psyche can be, and people work on their fear, they tell them a lot of these fallacies and they obey. But when it doesn't work, when it's not becoming a lot complicated, they now come and see the doctor and say, "Doctor, please help me." And ask them why. They say it's fear. So people in Nigeria, people in Africa have used the fear of women, fear of the fibroid, to work on people's psyche and take their money and just take their money and tell them one herbal medicines will shrink fibroid. Please, Oluwaseun, let everybody know today, and Lagos and the ladies in sports, no herbal medicines will shrink fibroid. It's one of the take home today that I want everybody to know. If you have these symptoms, please, it's important to see a medical doctor, see a specialist to get it sorted and get it checked immediately.
Wow, thank you so much. Actually, one of the reasons I'm so happy about this is, the regular person who has no solid information or knowledge about fibroids will get the real facts, which you have actually laid on the table. So remember the study I told you was done in Lagos? Let's go back to it, because you've already taken a peek into that. Now, according to that study, about 69% of the respondents believe that fibroid is a spiritual problem. And then some people actually think because it's a spiritual problem, of course, it has to require spiritual healing. Some people, like you said, believe that fibroids can be melted away using herbs. And the other people believe that surgery actually could lead to death. And like you rightly mentioned, fear is one of the reasons some people do not go for surgeries. But then let's tilt a bit towards the herbs part, because the truth is, it's everywhere on the streets of Lagos. In the eastern part of Nigeria, which I have seen quite a number of them, you hear people who are blaring horns and, they're speaking from the trunk of their car, "Come and buy this mixture, come and buy that mixture, it will flush it away." And it's even sad, there are some people who are supposed to be educated and learned who are still falling into the hands of these people.
Yeah. So
that begs the question, since we do understand that a number of drugs that we use these days actually take root in alternative medicine, in quotes. So the question is, what is the place of alternative medicine in the treatment of fibroids?
So there's no place yet, because all the drugs they talk about are not patented. They're not pharmacodynamics or pharmacokinetics. So I tell you, if you tell me that if I take 500 milligrams of this drug, I'll have relief in my headaches. So I know that if I take 500 milligrams of this particular medicines, that is adequately enough to take care of my headache. But you just tell me that go and take seven cups of this something, take 9 cups of this one, take 25 cups of this one. how many milligrams of those of what is in that water or whatever am I taking? What is the composition of? So if you can tell me clearly that, okay, Dr. Benjamin, this drug contains sodium chloride, contains that chloride, that fluoride, and all together becomes this herbal medicine. Okay, I'll take it. But most times I've seen people that have lost their kidneys taking these medicines over and over again because the medicines does not have particular dosage. Are we together, Sean? So people need to know that the side effects of these medicines are the challenge. So if the alternative medicine people want to give us drugs that will shrink fibroid out, so I ask them a very simple question. Take it to the pharmacy, take it to the lab. Tell us how many milligrams of that medicine you are taking would the patient take, for how long, and they will shrink. Let me tell you a story that I've seen personally. Some of these herbal guys that they call them Yalagbo, Mamalagbo, go to particular hospitals and buy fibroid masses. They buy it from doctors, from surgeons, from gynecologists. They buy it and put it in the formalin. So they'll tell you when you go to their rooms and tell you, okay, lie down flat in the tonal position. Then they'll put some leaves, some drugs into the person's vagina, and ask her to push. So you would think you are pushing out some things from your vagina, whereas they just bring out that particular mass that they bought from that particular doctor and show you that's what they brought out, using people's psyche, because people are afraid. What I realize that when people are afraid, they take anything hook, line, and sinker. I've seen lawyers, I've seen doctors, I've seen people that, because of fear, bankers, I've seen very learned people believe things that are not true because of fear. So what we have done is to try and take out the fear and put faith into the fear and make them know, please, these things you are taking will cause more damage to your life than good. It's important, as Dr. Abayomi has said today, seek a doctor's advice. It's important because no herbal medicine, you can see, when he was talking to me about fibroid, did you hear anything about herbal medicine? No, because no herbal drugs will shrink fibroids. It's all fallacies. It's all. I'm very, very passionate about it because I've seen patients that have taken this thing for years, wasting money, wasting resources that they don't even have to buy this thing and they don't give them for free. It's very expensive. Somebody says 40K per session, some 25K per session. You keep wasting that kind of money for years, 8 years, 10 years. Do the maths now. Even though you are saving one naira every day, you'll be able to save for the surgery and get it sorted. At the end of the day, you waste all your money on this thing. You still come out to do the surgery. Please, Oluwaseun, let the world know today. Let the ladies know today. Let it be clear to all of us that the answer to fibroids are invasive and non-invasive procedures as specified by Dr. Abayomi Ajayi today. Let your fear leave your body and let faith encapsulate you. The answer to fibroids is not about medicines. Don't waste your resources. Don't waste your time. Don't waste your emotions. Don't waste your finances. Please see a specialist today and get the special care you need for fibroid to be taken away. Thank you.
Thank you very, very much for clearing everything up. Thank you so much. I mean, right now, if anybody still wants to go ahead and make a wrong option, that is totally on them with the way you have entirely cleared it up, that, herbs and every other thing that anybody may want to recommend to you, maybe your family or that person in the village who, yes, they care about you, but at the same time, they don't exactly have the best option. Now, since you have already segued into the invasive and the non-invasive treatment, let's talk about the cost of treating fibroids actually. Is it very expensive? Because it's one of the reasons some people do not want to go to the hospital because they are scared of the health bill. And, currently in Nigeria, the healthcare sector is another topic for another day. So let's talk about the cost of treatment, especially as your foundation subsidized treatment for those people. How do you treat fibroids? What's the average cost?
So it depends on the location in Africa, in Nigeria. People say the cost of services on the island is not of course or the same cost of service on the mainland. It's the same cost in Abuja, not the same cost in Lagos. So for us, what we do is that the rural communities that have no access or have very low access. You imagine we've been to Bekwara. Bekwara is 39 hours from Lagos, it's 6 hours from Cameroon. And we went to that place. We did about 201 surgeries for free for women that have not thought about having access to healthcare in their entire life. So the average cost of fiber surgery is quite expensive. It depends on the location. People say between 500,000 naira and 1 million naira, 1.5 million naira, as the case may be, the aesthetics, the sophistication, the area, the vicinity, and everything. But for we, money doesn't drive what we do. Love and compassion is what drives what we do. So we're not in that league, that place of charging that kind of money, because our goal is to take out fear and take out fun. So we go to rural communities helping people, But if people want to get access to us in our facility in Lagos, it's quite very, 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 very affordable. Very, very, very affordable. It's not we're not allowed to say cost of services online, but you can reach out to me on all our platforms. We can just get you started on a scheme. But I can assure you, your fear will be taken away and your life will be restored by the grace of God.
Thank you so much for doing what you do, because that already gives hope. Now, since you've already mentioned that money is not what is driving you, if people want to seek out your services, how can they do that?
So so we're everywhere on Instagram, on Facebook, on LinkedIn. Just Benjamin Olojabu Foundation. Put it on Google. You can access our website www.bof.org.ng. You can access it. Then you could just send an email to Benjamin Olojebutu@gmail.com. You can check us out on Instagram at Benjamin Olojebutu. You can also check us out on LinkedIn, Benjamin Oluwatosin Olojebutu on LinkedIn. Just send us a DM. We'll just start talking about it. Don't let fun be the problem. Just let us know the story that we can work out modalities for you. We'll have some outreach very soon to in Lagos and outside Lagos, so you can also look us up on those medium. Then we can sort you out as soon as possible.
Thank you, Dr. Benjamin. I am very, very happy about this, because I know this information has reached a number of people that needs to have it. Because chances are, with the number that you released, chances are that we have somebody who has gone through this, or maybe somebody who's still scared of it, and you have totally allayed the fear. So thank you. Now, if you're joining us for the first time and you've missed out some of the information that he has released, what you need to know is that you do not have to worry so much about the cost. So seek out Dr. Benjamin Oluwojebutu across all social media platforms, from Facebook, Instagram, LinkedIn, Twitter, and also the Benjamin Oluwojebutu Foundation across all the social media platforms. Send a DM, whatever the story is. And the truth is, I can tell you for a fact that when you go through those social media platforms, you will see the pictures and videos of those people who have had the stories. I have gone through it, and it is so reinforcing and reassuring. So yes, it is not a hopeless case. It is not the end. It is not a death sentence. I am telling you this passionately, just as much as Dr. Benjamin is passionate about the cause. So again, thank you so much, Dr. Benjamin, for taking time out of your busy schedule, because I know you're a busy man. Thank you, and thank you again.
Thank you for having me today. God bless you. Thank you for every time.
Thank you. Do have a lovely day.
You today. Bye.
Now we go on a quick break, and when we come back, we'll be having the Gender Banking Officer of Wema Bank, that is, of course, Africa's first fully digital bank, joining us and talking about some things that you definitely want to stay tuned and find out. This is the Ladies in Sport Health Symposium titled Fibroids, What You Need to Know. Please stay with us.
Ever wondered how easy it would be if your bank was part of your life? Sort of like an assistant, a buddy, and a plug.
Alats, you there?
Always alert, sir.
I see what you did there. Am I up to date? What was that?
Your repayment has just been done. By the way, I found a cheaper ticket for your flight.
Awesome. Schedule my run for 7:19 a.m. tomorrow. I missed it this morning.
Already done.
What else?
Grocery shopping. The list has been sent to your phone.
Perfect. Anything else?
All done. Just get ready for your date.
All right, cool.
Welcome to the future of banking. Alat. Simple, reliable, and convenient. A smarter way to bank.
Thank you for staying tuned. And in case you're joining us for the first time, thank you for joining us. This is the Ladies in Sport Health Symposium tagged Fibroids, What You Need to Know. We've had quite the detailed session. And in case you've missed that, well, you need to find somebody who has been a part of it, and the person will give you a brief summary of all that has been talked about. But now we are going over to having Amarachi Ekomadu. She is the Gender Banking Officer for Wema Bank. Do not forget, it is Africa's first fully digital bank. She'll be talking to us about something that is specific, actually something very lovely for women, a product for women. It's tagged Sarah by Women. Now, a little bit about Amarachi Ekomadu. She is very passionate about preferring solutions to others while helping them grow. She's a gender backing officer at Wema Bank, like I mentioned earlier, and she has quite the experience working with women across all segments, be it professionals, entrepreneurs, and young adults. She's one of the pioneers of the Wema Bank Women Proposition, known as Sarah by Wema, and it's a driving force in women empowerment. Now, over the years, Amarachi has worked with the team that is a driving force and very big on women empowerment. You are here with Ladies in Sport International. That is all about leveling the playing ground for women. So this is such a delight. So please put your hands together while I bring up Amarachi Ekomadu.
Good afternoon, everyone, and thank you, Oluwaseun, for having me. Okay. Steve, just for confirmation's sake, can we all see my screen?
Yes, we can. Thank you.
All right, thank you. So good afternoon, everyone. My name is Amarachi Ekomadu. I am a gender specialist at Wema Bank, and I am excited to be amongst you all today. But before I go into what I'll be talking about today, I would like to use just a few minutes to applaud the organizers of this event. I mean, it's really is a laudable feat to see that women have been able to come together to create this sisterhood to support one another, even in a male-dominated industry such as sport. So well done and keep up the good work. So as earlier mentioned, I am a gender specialist at Wema Bank, and today I've been invited to talk to us about something peculiar to us as women, and that relates to both our finances and our lifestyle. But before I go into that, I'll start with giving a breakdown, a brief introduction of Wema Bank, what we are, what we stand for, and how we support women. So Wema Bank is the oldest indigenous bank in Nigeria. We've been in existence for over 75 years. But regardless of our age, of how long we've been in the game, we can say that we are one of the youngest at heart. About 4 years ago, we came up with the first fully digital bank in Nigeria. And this really shook the financial service industry, both in Nigeria and Africa as a whole. So our digital app, known as Alert by Wema, allows you to perform all your banking services from the comfort of your mobile phone without having to visit a bank. So what this means is that on the go there, you can open an account, just start transacting and perform every other transaction that you normally go to the bank to perform, like bills payment and so much more. Alongside being an innovative bank, we're very big at women empowerment and supporting women. And that gave rise to the creation of the Sarah by Wema platform. So what is Sarah? Sarah by Wema is the female proposition of Wema Bank. So this is a platform that has been designed to provide opportunities that will help women participate in, contribute to and fully benefit from growth opportunities in Wema Bank and also in the society as a whole. Sarah is for every woman, regardless of who you are. It's for the entrepreneurs, it's for the professionals, and it's even for young achievers. So if you're a young schoolgirl, Sarah by Wema is for you. We have something, we have 1 or 2 offerings for you. So we target women and we support women by providing the following value offerings. So we give access to finance. So as a bank, as a financial institution, we typically give access to finance. So the finances, go from personal loans to salary-based loan and even business loans. We give mentoring and networking opportunities, whether both informal and formal. So when I say this, what I mean is this: so the importance of networking cannot be overemphasized. It's always good to network. You network in your church, you network, in the places you work. You even just go out sometimes to network. So we recognize this importance, and for that we bring women. We bring just groups of women together from every walk of life, both those that are experienced, both those that are just new to the system. So most times we bring them together for them to share ideas. We talk to one another. Let them even know, okay, what am I doing? What do I need to do better? How do I grow from this? Most times we take people's experiences, and take it seriously and apply it to what and in whatever we're doing. So this is why we do our mentoring and networking as well. So another thing we do is access to information. Information is very important. So we provide information through our monthly newsletters and in every other way through social media. We just provide information to women in our network. So provide information on finances, career trends, business trends as well, well-being, family and relationship. Another thing we do is capacity building. So sorry, please, can we hear me? I don't know if I'm loud enough. Hi, Shell.
Yes, I can hear you perfectly. Thank you.
Okay. All right. So another thing we do is capacity building sections. So we organize various training, seminars, workshops as well, that targets both women finances, their lifestyle, and their well-being. So I'll be going into most of these offerings along the way, but I will start with our Sarah Health Plan. Prior to now, all the speakers that have spoken, Benjamin, Dr. Jai, they've spoken about health, how important health is, and why we should take care of our health. Instead of just Emmanuel just stated right now, Benjamin just stated right now that instead of taking herbs and all those things, that it's always good to go to the hospital, get diagnosis, and then seek and sought proper treatment. That is why we came up with this health plan, because we noticed that before now, a lot of women, if you feel you're sick, the next thing they do is they run to a chemist to get maybe malaria drugs, typhoid drugs, like self-diagnosis, and that's really bad, self-medication. So we came up with this health plan to provide you with quality health services at very affordable rates. So at 1,600 naira, you can go to a hospital and get doctor's prescription. You can go to a hospital, run tests, get the proper treatment for whatever is wrong with you. So this is a 2-in-1 plan. It features both a HMO plan and a hospital cash plan. So while the HMO plan takes care of all the medical bills, the hospital cash plan gives a subscriber access to the sum of 10,000 naira when you are hospitalized for a minimum of 3 days. And then amazingly, this 10,000 naira can even be accessed up to 5 times a year. So what this means is that you have access to about 50,000, but it will be given the badges of 10,000, depends on how many times you're hospitalized in a year. So this is available to every woman between the age of 18 to 65. So for those of us here that have dependents, people that know that if they fall sick today, I'm in charge of taking care of their medical bills, you can buy this plan today. We already have a lot of things bugging us. We already have a lot of things on our plate. So let us take away the stress of thinking of medical bills from you. Get the plan today. We also understand that a lot of people might not be able to, buy the plan at once. That is why we have divided it into 4 premium plans for convenience sake. So you can decide to be a monthly subscriber, you pay 1,600. You can decide to go for the quarterly, that's 4,600, semi-annual, and the annual payment of 16,000. So whichever works for you, that is good. This plan covers a lot of things because it was designed specifically for women, especially for women. This plan covers a lot of health concerns facing women. So it covers even specialist consultations. I'll be putting the link to the brochure where you get more information on this in the chat box later. And I'll also be putting a link to the subscription. Subscription is actually very easy. All you have to do is click on the link and it will take you directly to the platform for subscription. So like I said, onboarding can be done online using the link, and it can also be done in any Wema Bank branch. Also, right now in Nigeria, it has been shown that about 41% of entrepreneurs are women. I mean, that's a very, very large population. So because of this, Wema Bank came together and then we created an SME business school. Knowledge, we all know, is very important. It is key. You can decide to be a business person, but for your business to grow, for your business to actually grow from, maybe something you just did for start just for survival to something very big, you have to have the right knowledge to be able to scale it through. And that is why we came up with the SME business school. This is the first of its kind in the industry. So we're in partnership with Frankfurt School of Finance and Management, that's in Germany. And this School of Business is open to every registered business here in Nigeria. All you have to do is, it's open to every registered business here in Nigeria. And enrollment is totally free. You don't need to pay ₦1, it's totally free. It's available to all our customers as well. During this training, you get access to various courses, various knowledge base from top consultants within and outside Lagos. The topics that are covered, it includes both innovation, technology, finances, leadership, and so much more. This is a school every business woman should strive so hard to attend. Luckily, we just finished our first batch, and the testimonials have been really, really amazing. At the end of this presentation, we'll be playing a video to show you some of the testimonials from past beneficiaries. We are going to have another batch coming up before the end of the year, so you can still be a part of this. Just open an account and transact with us as long as a businesswoman. And if you also want to know more about this, follow us on social media so you do not miss out on the announcement for the next batch. So another way we support people, so I've been talking about how we train, we equip you with right knowledge to grow your business. So we also understand, and we've also realized, so we have even shown it several times, that another reason a lot of businesses fail is because they do not have adequate capital, or they do not have the adequate finance to support their business. That is why in Wema Bank, we have come up with various loan offerings at affordable and friendly rates that do not even have stringent requirements. So first of all, I'll be talking about the SME discounted finances for business owners. So this finance is a non-collateralized 9% loan. So you do not need to bring any collateral. You do not need to bring a land. You don't need to bring your car, nothing, or even your house. We don't need your collateral, and it goes for 9%, only for business owners, female business owners. Use it to support your business, to run your business, and maybe you want to restock. So this is what this loan is used for. All you have to do to qualify for this loan is just increase your deposits, increase how you transact on all our channels, on our digital channel, our alert platform, our USSD platform. Just increase how you transact them, and also increase your deposits, and you qualify to get up to a sum of 1 million at 9% interest rate payable for 6 months. We have other loan offerings as well, a bouquet of other various loan offerings, and this include the business support facilities for business owners as well. So it's also non-collateralized. You can get up to 5 million naira and it's payable for a period of 12 months. Can get between 100,000 to 5 million, no collateral required. It's available to all businesses registered and unregistered. We have the DBN loan. The DBN loan, you get up to a sum of 200 million at 15%. And you can pay up to 10 years, but we require collateral for this type of loan. We have the school support loan. That is for the school owners in the building. So if you have a school, be it crèche, nursery, primary, whatever school, you can access this thing. You can get up to 10 million naira without collateral. So we also have the loan for those in the medical line. So we have the farmer loan, we have the med loan. So Dr. Ajayi, in case you want a loan for your hospital, we have a med loan for you. You can come and take it. You can get up to 10 million naira and you do not even need collateral. All you have to let it just be that your hospital is licensed and you are a health service provider, and you can get up to 10 million naira with no collateral. So we have the device loan as well. But right now, COVID happened and a lot of us have, been working from home for a while now. So before the COVID happened, a lot of us don't even have laptops. Some of us don't have good phones. But now we know that the need for, gadgets has been on the rise. So you can come to us, collect a device loan up to the tune of 500,000, purchase that laptop, purchase that phone today, even for your children and for yourself. So we've been talking about, okay, we've been doing this, transact with us, we give trainings and all of that. So now, Wema Bank, in as much as we provide value, we're also a very appreciative bank. We appreciate our customers, those that are transacting with us, those that have been there with us. And that is what gave rise to our 5 for 5 promo. The promo has been up since July and is running till March 2022. So even people on this platform can open their accounts today and take part in this promo. So the 5 for 5 promo is for every customer. You can get up to the sum of 1 million naira. All you have to do is fund your account with a minimum of 5,000 naira monthly, maintain a 10,000 naira account balance monthly, and also do a minimum of 5 transactions on our digital platforms. And you can stand a chance to win. This is not even a loan. This is free money. You can stand a chance to win from 10,000 naira to 1 million naira. So you can win 10,000. You can be one of our lucky winners to win 100,000. And you can even be the winner to win 1 million. This promo runs till March 2022. As you can see, our top winners have been women. These are women like you and I. So you can be a part of this. The testimonials have also been amazing from them. So today you can start transacting today. You can open an alert account today and start transacting to win free money. I just talked about opening an account. So for those of us that, to open the account right now, all you have to do is go to your Play Store or go to your App Store, type in alert, and then you download the app, sign up, follow the prompt and to sign up. And in less than 5 minutes, you will get an account number. So the alert platform, like I said earlier, is the first digital bank, fully digital banking app in Nigeria. So it allows you create an account in 5 minutes. On alerts, you can even have a flexible savings plan, and we call it gold. So this goal comes in 3 ways. So you can decide to make it fixed. So in the fixed, you cannot withdraw money. So any money that you put in the fixed goal, it is fixed there until the time you have already, maybe you fix it from now to December 25th. So that money is fixed there to December 25th. You cannot perform any withdrawal. We have the flexi goal. The flexi goal allows you withdraw 50% of your savings in every 30 days. And then we also have the stash. The stash just allows you to save as you go. So whenever you want to save, you just put money there. So that is the stash. You can schedule payments. You can schedule all your payments, whatever payment you want, you can schedule your payments. You can also request for our device loan and our salary-based loan. So the salary-based loan is a loan for salary earners. I know I've been talking about business people, how the loans business people can get. So this salary-based loan is for salary earners. So if you're a salary earner, all you have to do is come to the alert platform, go to the loans, request for a loan, have handy your staff ID card and your accounts, your salary account statement, and you can collect up to 4 million naira at the interest rate of 2% monthly. So we have the alert for business as well. That is for business people. So no more going to the bank to queue up because you want to perform 1 or 2 transactions for your business. The alert for business helps you do that. That is a mobile app for your business accounts. So you can perform daily transfers up to the volume of 2 billion naira. You can do bulk transfers up to 5,000 bulk transfers. You can, do FX transfers to your remitter, bills payments, and also download your account statements. Like I mentioned, within various sections. So we're also big on health, as you can see. So what you see here is the activities we've done in the past. So we see our health, sexual health webinar that happened 2 months ago. That's for cervical cancer, talking about the preventions and treatments. You can see a breast cancer awareness webinar we did last year as well. And after this, we had free mammogram sections for about 50 women. So these are things we've been doing in the past. So it's a very, very interesting platform to be on. So stay connected with us so you do not miss any of our upcoming events, and also do not miss our next SME business school. So stay connected. Follow us today on Tara by Wema and Wema Bank. And if you also have any mails or you want to also get in touch, maybe one-on-one questions, you can send us a mail today at tarabywema@wemabank.com. Thank you.
Thank you so much, Amarachi. That was very detailed, and well, it had my mouth watering because of some of the things you dropped. Now, if you're watching or you're just joining us and you didn't miss or you didn't get any part of what she said, let me remind you of some keywords. There is promo, there is free money, 1 million naira. And then if you're wondering how all that connects, you should definitely follow them across all social media platforms. Sarah by Wema. Another account you should follow is Wema Bank. That's the official account. And also Alerts by Wema. That also you should go because there are a lot of juicy details. I know chances are that you're trying to connect, you're trying to scoop everything and you're wondering which one should I go for. Just go follow them across all social media platforms. You'll see the information right there. And of course, she has dropped the link for you to ask questions and seek clarification. So thank you, and thank you again, Amarachi. It's a pleasure having you talk about all of this and what we have to gain from it, especially how healthcare is such a big concern in Nigeria, considering what we have. So thank you, and thank you.
Thank you very much.
My name is Ade Tabimbola Moses.
Ike Rebecca Chidima.
Kurocho Gladys Chineyinwa.
Olua Jeremy Adewale.
I am Salami Abiola.
Olatunde Grace Oluwakemi.
My name is Adunola Olatuji.
And I'm here at the Wema Bank SME Business School, and I'm just here to say that I'm super excited and grateful to be part of this program. It's been amazing. It's been value packed.
I am not a customer. I don't use Wema Bank, but despite the fact they took me in,
I've learned so many things: legal framework, taxation, financial planning, and everything needed to learn.
the classes has been really amazing. It has been enlightening.
I'm so happy to be here, and I give glory to God and to Wema Bank for making me be part of this program.
I gain a lot, even concerning my accounting and bookkeeping.
Ever wondered how easy it would be if your bank was part of your life? Sort of like an assistant, a buddy, and a plug.
Alerts, you there?
Always alert, sir.
I see what you did there. Am I up to date? What was that?
Your repayment has just been done. By the way, I found a cheaper ticket for your flight.
Awesome. Schedule my run for 7:19 a.m. tomorrow. I missed it this morning.
Already done.
What else?
Grocery shopping. The list has been sent to your phone.
Perfect. Anything else?
All done. Just get ready for your date.
All right, cool.
Welcome to the future of banking. A lot. Simple, reliable, and convenient. A smarter way to bank.
If you think of Wema Bank, you should think of ease, you should think of excellence, you should think of fairness, and of course, gender equality, which is why you should go follow them across all social media platforms, Alert by Wema, Sarah by Wema, and of course, Wema Bank, so that you do not miss out on any of the goodies they are offering you. Easy like Sunday morning. And again, thank you so much to Wema Bank, our sponsor, and of course, Smooth FM too, another of our sponsors. We really do appreciate this because you helped to make this happen. Of course, we're very grateful to Dr. Abayomi Ajayi of Nautical Fertility Center, to Dr. Benjamin Oluwojebutu of Benjamin Oluwojebutu Foundation, and of course, Amarachi Pomadu for taking out her time to come speak to us about the products that are specifically for women and more of the offers that they have for the general public. And to you for staying tuned and, staying with us from the beginning of this till the end. Importantly, now that you have been enlightened, please do not keep this information to yourself. It's for the general populace. More people may know about fibroids, but do they really have the actual information? Do they have the facts? Do they have the things that will actually not make them be fearful? So now that you have the information, please do not hold it to yourself. Share it, and of course, go across all the social media platforms of Dr. Abayomi, of Dr. Benjamin, so that you're fully informed about what to do and how best to refer a person. Thank you, and thank you again. This has been the Health Symposium organized by the Ladies in Sport, a non-governmental organization that is all about advancing the causes of women in sport. My name is Oluwashim Olusegun. Now, do not forget to follow the Ladies in Sport across all social media platforms, like I earlier said, Facebook, Instagram, and Twitter, and of course on LinkedIn. I do hope, we have another chance to enlighten more about this, but till then, we hope that you take care of yourself. COVID-19 is very much out there. Please do the necessary, do the needful. Wear your mask, sanitize, and socially distance. Again, my name is Oluwashim Olusegun, and thank you so much. Bye for now.